Hi, everybody. I'm Lori Johnson, CBN's medical reporter, here to answer your coronavirus email questions. Joining me today is neurologist and best-selling author Dr. David Perlmutter, whose latest book is called Brainwash. Welcome, Dr. Perlmutter.
Hi, Lori. How are you doing?
Fine, thank you. Well, before we get to the email questions, I wanted to get your thoughts on letting kids go back to school. We've heard that they're at much less risk for getting this disease.
That's a great question. And, certainly having kids out of school for this prolonged period of time is really something to be concerned about. But the question would be, what is their risk of infection? And also, what is their risk of bringing home that infection to mom, dad, and the grandparents? So we don't really know that there's much of a difference in a child's risk of infection. The thing about children is they manifest a lot lower symptomatology, and many of them, in fact, cannot even have symptoms. So we get a sense that kids just aren't infected by coronavirus. The reality is most of the science is indicating that, in fact, they do. Then the question becomes, well, then how safe are they at school? And I think, with the appropriate social distancing, which is something they're going to have to learn, it could be done appropriately. But then the issue is what happens when they contract this virus and then bring it home to other family members. And that, I think, still is an issue that we have to work through because I think it's very real. The idea of sending our kids to school and then they're coming home in the afternoon really, I think, has the potential to open up people who are at risk to contracting COVID-19 and potentially even having a serious consequence from that infection.
All right. Well, let's get to the email questions. Janice wants to know, do you know if COVID-19 can be transmitted by mosquitoes?
There is no evidence that COVID-19 is transmitted via arthropod vector or any insect for that matter. Now, we've had other experiences recently with things like dengue and Zika virus that were transmitted by mosquitoes. Many of your viewers will recall Zika, for example. But there is no evidence this time around that coronavirus is transmitted via any insect vector.
Judy asks, will staying inside weaken your immune system?
Well, we know that getting outside strengthens the immune system. So I don't know if staying inside is net neutral. It really depends on what you do when you're inside. You need nature exposure, but nature exposure, oddly enough, doesn't necessarily mean that you have to go outside. The research shows that even having a houseplant is a level of nature exposure that is good for your immune system.
Wow, that's so interesting. So everybody go buy a house plant. All right. Richard wants to know, do you agree with optimists who say by May 15th, things will be 50% back to normal?
I'm not sure how you define 50% back to normal. I think clearly things will never be as they were, at least in our lifetimes. And the idea of 50% back to normal from a health perspective, that is exceedingly unlikely in a week or two. The idea that 50% better from an economic perspective is also unlikely when it's been estimated that around at least 20% of small businesses will close permanently. And that's a powerful argument against reaching 50%. So I think it's going to last a lot longer. And I do believe we will have a second wave. The question is, how high will that wave be and when will it come? And a lot of that is dependent upon how much longer we continue the social distancing types of activities, the hand washing, et cetera, as well, that tend to limit the spread of the virus while we re-engage the economy.
All right. Well, that's all the time we have for now. Our thanks once again to Dr. David Perlmutter. And if you'd like to hear more from Dr. Perlmutter, check out his website, drperlmutter.com.